There is a silent threat moving across America. It is not a hurricane. It is not a wildfire. It is a tiny insect with a deceptively gentle name, the kissing bug. This small creature carries a big danger. It spreads a parasitic illness known as Chagas disease. For many years, we thought of Chagas was far away, mainly in rural parts of Central and South America. But now, the reality is changing. The kissing bug is here, in the United States. It is living in our own backyards. It is putting more families at risk than ever before. We need to pay close attention to this emerging health concern right now. The name kissing bug sounds almost harmless, but the name comes from its unsettling habit. The bug is drawn to the carbon dioxide we exhale as we sleep. It often bites on the face, near the lips, near the eyes. This is the kiss that can lead to a lifetime of health problems. The danger isn't the bite itself, but what happens next. The bug often defecates near the bite wound. The parasite can enter the body if feces are accidentally rubbed into the bite, the eyes, or the mouth. This is how the infection begins. A quiet invasion that can go unnoticed for years, even decades. Knowledge is our most powerful tool. The first step is to learn the facts about this silent intruder. Let's start that journey together, right now, before this problem grows any larger. So, what exactly is this kissing bug? The scientific name for these insects is triatomine bugs. They are a type of reduviid bug, sometimes also called assassin bugs or cone-nosed bugs, found across the Americas. More than a dozen species live in the United States, typically found in the southern half of the country, from California to the Carolinas. These bugs are not like mosquitoes or flies. They are nocturnal, most active at night. During the day, they hide in dark, sheltered places. These bugs are bloodsuckers. They need blood meals to survive and reproduce, much like a mosquito. Adults about half an inch to a full inch long, often dark brown or black, with distinctive orange or reddish markings along the abdomen. Narrow, cone-shaped head, long thin legs, noticeable antennae. This helps distinguish them from cockroaches and beetles. The danger isn't the often painless bite. The real threat is their feces. They carry the parasite Trypanosoma cruzi in their digestive tract. After feeding, they often defecate near the bite. The parasite is in those droppings. If a sleeping person scratches the bite or touches their eyes or mouth with contaminated fingers, the parasite can enter the body. That's the primary way Chagas disease is transmitted. The bug is the vehicle, the vector, for a microscopic invader. Not every kissing bug is infected. Infection rates vary by area. Because you can't tell by looking, treat every encounter with caution. They can enter homes, hiding in cracks in walls, under mattresses, or in cluttered areas, waiting to feed. Chagas disease is the illness caused by the parasite Trypanosoma cruzi. It is a complex and often misunderstood condition. The disease has two distinct phases, the acute phase and the chronic phase. The acute phase begins shortly after the parasite enters the body. This initial stage can last for a few weeks or a couple of months. Parasites circulate in the bloodstream in high numbers. Symptoms are often mild or absent. Many people don't realize they've been infected. If symptoms appear in the acute phase, they are usually nonspecific. They can be mistaken for the flu, fever, fatigue, body aches, headache, rash. Sometimes a visible sign appears at the bite site, a purplish swollen area called a chagoma. If the parasite entered through the eye, one eyelid may swell. That's Romanna's sign, a classic acute indicator. But many infections proceed silently. After the acute phase, the disease enters the chronic phase. Parasites stop circulating widely in the blood. They embed deep in body tissues, primarily in the heart muscle and in the digestive system. For years or decades, the disease can be indeterminate, no symptoms. The person carries the parasite but feels healthy. This long silent period makes Chagas deceptive. Infection in childhood may not cause problems until middle age. The real danger emerges later. In about 20–30% who reach the chronic phase, parasites begin causing serious damage. Over time, this leads to severe, life-threatening conditions. One of the greatest challenges with Chagas disease is its quiet nature. As we've discussed, the initial acute phase often passes with no symptoms at all. Imagine getting a small bug bite one night. You might not even wake up. If you do notice it, you might just dismiss it as a mosquito bite or spider bite. Even if you feel a little unwell for a few days with a low fever or some fatigue, you would likely blame it on a common cold or flu. You would rest, drink some fluids, and move on with your life, never suspecting that a parasite has just taken up permanent residence in your body. This is the reality for the vast majority of people who become infected. This lack of clear, early symptoms is why Chagas is often called a silent disease. It doesn't announce its presence. Years can go by, decades can pass. During this long, asymptomatic chronic phase, the infected person feels fine. They live a normal life. They work, raise a family. They have no reason to see a doctor for this specific issue. The parasite is hidden away in their heart tissue, slowly causing inflammation and damage that is not yet severe enough to be felt. The parasite is hidden away in their digestive muscle tissue, slowly causing inflammation and damage. This makes detection incredibly difficult. Without a reason to test for it, most doctors would never think to look for Chagas disease, especially in a patient who feels perfectly healthy. The only way to know for sure if someone has Chagas during this silent phase is through a blood test. There are specific tests that look for antibodies to the T. cruzi parasite. Antibodies are proteins that the body's immune system produces to fight off an infection. If these antibodies are present in your blood, it means you have been exposed to the parasite. However, routine physicals do not typically include a test for Chagas. Doctors usually only order the test if there is a specific reason to suspect the disease. This creates a dangerous gap in our healthcare system. The vast majority have not been diagnosed. They are walking around with a ticking time bomb inside them and don't even know it. For a long time, the story of Chagas in the United States was primarily about immigration. The disease was thought to be confined to people who were infected in their home countries and then moved to the U.S. People may have been infected as children and carried the parasite with them, unknowingly, for their entire lives. Major cities with large immigrant communities, such as Los Angeles, Houston, and Miami, have become hotspots for these imported cases. This remains a major part of the Chagas picture in America. However, a new and more alarming chapter is unfolding. We are now seeing clear evidence of local transmission. This means people are getting infected right here, on U.S. soil, from American kissing bugs. The parasite and the bugs that carry it have been found in at least 28 states, primarily across the southern half of the country. Texas is a major hotspot, with a high number of infected bugs and documented cases of local transmission. California, Arizona, Gulf Coast states, Georgia, the Carolinas. This is no longer just an imported problem, it's a homegrown one. Several factors are contributing to this spread. Climate change is one. As temperatures warm, the geographic range where these insects can survive and thrive is expanding northward. They are becoming more common in areas where they were once rare. Another factor is increased development. As we build homes and communities in more rural and wooded areas, we are coming into closer contact with the natural habitats of kissing bugs and their animal hosts, such as raccoons, opossums, and wood rats. This brings the bugs and the parasite they carry right to our doorsteps. Our modern lifestyle is, in some ways, increasing our exposure to this ancient disease. The CDC has documented several cases where people who have never traveled outside the country have become infected. There have also been cases of transmission through blood transfusions, organ transplants, and congenital transmission from mother to baby. The true tragedy of Chagas disease lies in what happens decades later, after the initial, often unnoticed, infection. For the roughly 1/3 of individuals who develop the chronic symptomatic form, the consequences can be devastating and life-altering. The most common and most serious complication is Chagasic cardiomyopathy. The Trypanosoma cruzi parasite has a particular affinity for heart muscle tissue. Over years, the chronic inflammation caused by the parasite leads to scarring and a weakening of the heart muscle. This is a slow, destructive process that unfolds silently over time. As the heart muscle weakens, it can become enlarged and floppy. This condition is called dilated cardiomyopathy. A heart in this state cannot pump blood effectively to the rest of the body. This leads to the symptoms of congestive heart failure, shortness of breath, extreme fatigue, swelling in the legs and abdomen. Furthermore, the damage to the heart's electrical system can cause dangerous arrhythmias, or irregular heartbeats. These can lead to fainting spells, strokes, sudden cardiac arrest, and death. For many young or middle-aged adults with unexplained heart failure, Chagas disease is an overlooked but possible cause. Beyond the heart, Chagas disease can also attack the digestive system. This is less common than cardiac complications but can be just as severe. The parasite can damage the nerves that control the involuntary muscle movements of the esophagus and colon. When these nerves are destroyed, the muscles can no longer function properly. This can lead to megaesophagus and megacolon. Patients can suffer from extreme difficulty swallowing, malnutrition, and aspirating food into their lungs. For both heart and digestive issues, treatments focus on managing symptoms. Early diagnosis and antiparasitic treatment can prevent lifelong suffering, but once severe organ damage occurs, it is irreversible. The good news is there are practical, common-sense steps you can take to reduce your risk of encountering a kissing bug. Prevention starts right at home by making your environment less attractive to these nocturnal insects. This is a strategy we call vector control. It's all about creating barriers between you and the bugs. Start by sealing any potential entry points into your house. Use caulk to fill cracks and gaps around windows, doors, and foundations. Check for holes in your window screens and door screens and repair them promptly. These small openings are easy entryways for bugs. Next, focus on the area immediately surrounding your home. Kissing bugs love to hide in messy, sheltered places during the day. Clean up any piles of wood, rocks, and brush that are close to the house. Keep your yard tidy and move wood piles away from the walls of your home. If you have a porch with outdoor lighting, be aware that lights can attract insects at night, including kissing bugs. Consider using yellow bug light bulbs or simply turn off unnecessary outdoor lights after you go to bed. The goal is to make the perimeter of your home an uninviting space for these creatures. Pets can also play a role in the cycle of Chagas disease. Dogs can become infected. They don't transmit the disease directly to humans, but their presence can attract kissing bugs. If possible, have pets sleep indoors at night, especially in areas where kissing bugs are common. If you have outdoor dog houses, chicken coops, or animal pens, check them regularly for signs of bugs. Keeping these areas clean and well-maintained can make a big difference. Finally, a few simple habits inside the house can add another layer of protection. Avoid sleeping on the floor or placing mattresses directly on the floor. Keep your bed and furniture away from walls. Reduce clutter inside your home. These are not drastic measures. They are simple, proactive steps that can significantly lower the chance of a kissing bug finding its way to you or your family. Let's say you find an insect in your home that you think might be a kissing bug. What should you do? Don't panic. Do not crush or squash it with your bare hands. The parasite can be in the bug's feces, and crushing it could expose you. Capture it safely so it can be identified. Use a container, slide paper underneath to trap it, and put it in the freezer or alcohol to preserve it. After capture, get it identified. Contact your local health department, state health department, or university extension program. Take a clear close-up photo of the bug. Photos help public health officials track sightings. If confirmed positive, talk to your doctor. Your doctor can assess exposure risk and order testing if you were bitten or think you were exposed. The story of Chagas disease in America is a quiet one, but it is a story that we can no longer afford to ignore. This is not a distant threat from a faraway land. It is here, in our country, in our states, potentially in our own neighborhoods. We are at a critical moment. We can get ahead of this emerging public health challenge, but we must act now, and we must act together. Awareness is our first and most powerful weapon. Share this knowledge. Talk to your friends, family, and neighbors. Clinicians must also act. Watch for unexplained heart failure, abnormal EKGs, difficulty swallowing. Ask the right questions and increase testing. Preventing spread is a shared responsibility. Individual action: seal your home, clean your yard. Community action: report bug sightings, support public health initiatives. The threat is real. Our capacity for action is greater. Don't wait for a loud crisis. Raise your voice, spread the word, take simple steps to protect your community. Our health depends on it.